The biggest problems for rehabilitation are access to services, the resources, and patient compliance. So although the first two are about funding, no amount of money can fix patient compliance. And we know traditional therapies work, and they work very well, but if patients aren't going to do the exercises that we know will help them, they're simply not going to get better. I tried to develop a therapy protocol that would be fun and that people would enjoy doing and want to do, and we developed Wii-based movement therapy, which uses the Nintendo Wii as a tool. So this is a 74-year-old male, 8 months post-stroke, and this is his first day of therapy. And you can see that he's using his less affected hand, which is the one closest to the camera, just to provide support. But you can see the movement is very stiff and small. So here he is again after 2 weeks of therapy. So this is day 10, and you can see that already he's got much stronger movement, a larger range of motion, more power and more speed. So here's a 73-year-old male, 27 months post-stroke, and he's playing Wii boxing. He came to us because he thought his lower legs needed work and his upper arms were just fine. And you can see here as he starts to box that he's got a very small range of motion, very stiff, and he's not moving his feet at all. And here he is after 2 weeks of therapy, doing the same activity, and again you can see a much greater range of motion, and he's stepping quite freely and transferring his weight. How does that improvement translate into everyday activities? Well, this is a 67-year-old male, 11 months after therapy, and here he is picking up the pencil, and his task is to pick it up using a tripod grip. And you can see he's having great trouble picking it up, and he's dragging it across the table, which he's not supposed to do. But great determination, and finally, he gets it. So here's the same gentleman after 2 weeks of therapy doing the same task. And you'll see that straight away he can pick up the pencil much faster than he could before without dragging it across the table. We would like to try it soon in Parkinson's disease, cerebral palsy, in fact almost any kind of movement disorder. We think there's potential for improved movement ability. It's really exciting. We find one of the big things is people say they now have hope, whereas before they didn't. And in fact, we had a gentleman come back recently, 3 years after he finished with us, having had a leg amputated and trying to work out how he can continue to do Wii therapy. So we know that not only are they doing what we ask them to do, but they continue to do it long after they've finished our program. In some cases every day, and that's really exciting.